Hello and welcome to the second session from the MAT team. Today we're going to be talking about the 7 deadly sins of running assessment.
大家好，欢迎来参加我们 MAT 课程的第2节课程。我们今天的课程主题是跑步评估当中常犯的7个大错。
So running is a big activity that many people do, but it's often something that lots of people have difficulty or injuries with.
很多人都喜欢跑步，同时也很多人因为跑步而受伤或者遇到了困难。
And today we're going to talk about how we can improve assessment or mistakes not to make in assessment.
那今天我们要讲的就是怎么样改良或者改善跑步评估的质量。
With me again today is my business partner, Andrew Lemon. Andrew, tell us a little bit about running assessment.
和我在一起的是我的小伙伴叫安德鲁莱蒙。那么安德鲁现在请跟我们讲一讲那个跑步评估。
Well, I think, Stephen, before we get into discussing running assessment, one of the things that we first need to talk about is how important it is to assess runners in the modern world.
OK， 好的，史蒂芬。那么在我看来，我们在讲跑步评估之前，我们首先要聊一聊，就是在现代社会对跑者群体进行评估的重要性。
For many of us, we have been restricted in the types of exercises that we can perform.
对于我们的很多人来讲呢，就是我们能进行的运动的类型是有限的。
And for many people, they have all of a sudden returned to running after a long time of not performing this activity.
而且在当下，对于很多人来讲，他们是长时间没有进跑步之后呢，突然又回到了跑步这项运动上。
Now, while this is fantastic that many people are getting fit and healthy, unfortunately, it is probably going to lead to an increase in the amount of injuries.
一方面，人们选择在这个时候通过运动来强身健体，通过跑步来强身健体是很好的一件事情，但同时这也意味着跑步损伤概率发生以及跑步损伤的发生率可能会提高。
We've definitely seen a lot of new running injuries in people who haven't run in our own clinic here.
在我们这里确实有看到很多人因为长时间没有跑步，突然回归到跑步上而受伤了。
And there are many common areas that we see a lot of running injuries.
关于跑步损伤，我们可以看到有几个地方是最常受伤的。
Of course, most of these injuries affect the leg or the lower limb.
大部分的跑步损伤都是发生在下肢。
As we can see from this graphic here, many injuries particularly also involve the knee.
在这张图上还可以看到很多跑步损伤还发生在膝关节。
But if we are to assess the people that we work with, the runners that we see effectively, we need to consider them as a whole body too.
但如果要有效的去对受了伤的跑者进行一个评估的话，那我们要将跑者评估的时候看作一个整体，而不是只看一个局部。
And this is where our presentation today will cover all the areas that you need to consider to make sure you assess the runners you see more effectively.
所以我们今天的这堂课将会涉及到评估跑者的时候，你需要涵盖的所有的地方、所有的区域，这样的话呢，才能够让你给到跑者客户更高效的评估。
The reason why a lot of running injuries occur, Stephen, is often because of some of these points.
史蒂芬呢，你知道吗？就是为什么很多的跑步损伤会发生，都是因为这张图上面所列出来的原因。
We know that running can be a very high impact exercise, right?
首先我们知道跑步它是一个可能会对你的身体产生较大的冲击力，对不对？
Yes, there's a lot of force that goes through the lower leg when you're running. 1.5 to 3 times body weight goes through the leg each step when you run.
是的，因为你在跑步的时候，作用于身体的反作用力是很大的。这个反作用力是你每一次触地都会有承受自身体重1.5倍到3倍的一个反作用力。
And sometimes you've got people doing this for 20, 40 or 100 kilometers.
而当我们说到有些人他在跑的时候，一跑就是20公里、40公里，甚至是到100公里。
And with that amount of force going through the leg each step you take, it's no surprise that over 70% of runners get injured every year.
再结合我们前面说过，每一次触地都会有这么大的一个反作用力，这也就难怪每年会有接近79%的人会有受伤，或者接近70%的一个受伤率。
And 80% of those injuries are repetitive strain injuries or overuse injuries, meaning that there's not a traumatic incident. They come on over a period of time.
而这其中有80%的损伤都是由于过度使用或者是重复性劳损来造成的。换句话说，就是这80%的损伤都不是即兴发生，而是长时间的积累而发生的。
And people new to running are especially likely to get injured, Andrew.
Sorry, could you just repeat?
People that are new to running are more likely to get injured.
OK， 那么我想问了，那个跑步新手是不是更容易受伤呢？
That's right, Stephen. So people who have run for less than 3 years' time are 2.2 times more likely to suffer an injury.
没错，跑步经验少于3年的这些跑步新手，他们受伤的可能性要高2.2倍。
So this is particularly all of those people who have just started running as a form of exercise in the current world environment.
而我们现在所说的新手的话，其实从当前的形势来讲，基本上是以前从来没有跑过步，或者是很久没跑步，然后现在突然开始跑步的这些，都可以算作是新手了。
And unfortunately, 50% of those new runners who get injured then won't return to that activity, which is sad because it is a great form of health and fitness.
遗憾的是，近50%的新手他在受伤过后不会再继续跑步，这是一件非常令人伤心的事情。毕竟跑步本身是一个很不错的强身健体的运动项目。
So, Stephen, we need to make sure that we know all the 7 deadly sins of running assessment.
OK， 所以史蒂芬，我们一定要来认识一下跑步评估的7个大错。
To make sure that we keep as many people fit, healthy, and running for a long time.
这样的话呢，我们才能够帮助更多的人长期维持健康，以及长期享受跑步。
So the first deadly sin of running assessment is not knowing the risk factors.
那么第一个跑步评估的大错就是不了解风险因素。
So what does this mean, Andrew?
安德鲁，这意味着什么呢？
So what this means is that we need to know some of those facts that we discussed before.
这就意味着我们需要再回顾一下我们前面有提到过的一些事项。
But also understanding in our questioning of our patients what they have experienced previously.
而且呢，这还意味着我们在向跑者客户提问的时候，要借此了解他们过去的经历。
For example, if we see a runner who has had an injury in the last 12 months, this increases their risk of another injury.
举个例子，比如如果我们眼前的这个跑者客户，他在过去12个月内有受伤，这意味着他接下来受伤的概率会更高。
We also need to understand how body weight can affect risk of injury.
我们还要了解体重将如何影响到他的损伤概率。
Obviously, heavier individuals have more force when they go through their body.
那显而易见，体重越大，那么他在跑的时候，身体所承受的反作用力也越大。
So we need to make sure that our more overweight patients understand this before they start to go and run.
像这一点知识，一定要让我们的超重的那些又要想要去跑步的客户提前先要了解到，然后呢，这样才能够做好一个预防。
How our patients or clients train can also be a big factor as well, Stephen.
然后史蒂芬，你知道吗？我们的客户他们一直以来是怎么训练的？这个也会是影响跑步损伤的一个因素。
This is no surprise that individuals who do more running but do not have a previous history of running are more likely to get injured.
这个点很好理解。比如说，如果这个人他过去没有跑步的经历，而最近呢又进行了大量的跑步，那么他损伤的概率会更高。
Or people who run 6 to 7 days in a week and do not have enough rest also have a much higher chance of injury, up to 64%.
同样的，如果这个人他每天6到7天都在进行跑步，就没有得到一个充分的恢复，那么他损伤的一个风险也会很高，会增加64%。
Or if they increase their workload a lot in 1 week, it makes them more likely to get injured in the following weeks.
又或者，如果他在1周之内的跑量增加的太多，那么他在下一周受伤的概率也会更高。
So by understanding these common training problems and reducing the impact of these, we can hopefully decrease people's risk of injury.
所以呢，在我们了解了这些就是训练量与损伤概率之间的关系以后呢，我们将能够更有效地帮助客户减少他们的损伤风险。
We also see that people who train too little also have an increased risk of injury.
我们还会看到那些训练不足的或者训练量太少的客户，他也可能有产生损伤。
For example, only running once a week can increase the risk of injury by 78%.
举个例子，如果1周只跑步1次，会增加78%的损伤风险。
And we also see that running less than 2 hours total a week can also increase this risk of injury in males and females.
我们同样还会看到，如果每周跑步的总时长少于2个小时，同样会增加男性跑者和女性跑者的损伤风险。
So it seems if you run too little or too much, is more likely to get injured.
所以可以看到，无论你的跑量是过少还是过多，都有可能增大你的损伤风险。
We need to find the balance in the amount of training our patients or clients perform, as well as their rest and recovery.
因此，我们需要帮助客户找到一个恰当的跑量、训练量，以及要在他们的训练和恢复之间帮他们找到一个平衡。
And this has been described in many pieces of research as finding the sweet spot of training.
现在这张图上所呈现的呢，其实已经被很多领域的训练学家应用于他们的训练理论和训练实践当中。然后这张图告诉我们的是，你要如何找到它的最大收益区。
So this is where we need to use our assessment skills for each individual, because everyone will be a little bit different.
但是考虑到每个人都会有自己的个体差异，所以说我们在应用这幅图的知识的时候，也是要注意这些个体差异。
Now, an underutilized and underassessed part of the body or part of the capacity of an individual for runners is flexibility.
接下来我们要知道的是，对于跑者的评估，常常被忽视或者是不够重视的一项能力素质就是柔韧性。
There's actually lots of research showing that stretching can have some positive effect on runners.
实际上有很多研究显示，进行拉伸可以为跑者的表现带来有益的作用。
Even though stretching traditionally isn't performed a lot by running individuals.
即使说在传统上，跑者不会做太多的拉伸，不会做很多的拉伸。
So what do these studies show, Andrew?
那么安德鲁，你来说说看，这些研究告诉我们什么呢？
Unfortunately, many pieces of research have also looked at injuries and shown that it wasn't effective in reducing risk.
不过不幸的是，有很多的研究也显示说，做拉伸并不能有效的降低损伤概率。
Often this is because these pieces of research have taken a generalized approach to looking at flexibility.
那也是一个常见的原因，往往是因为这些研究他们在看待拉伸的时候，将看得太泛了。
It hasn't considered the need to assess the individual specifically to identify if they have a flexibility limitation.
因为那些研究没有去考虑，就是受试者本人这个个体他是否存在像一些柔韧性上的局限。
This is why we choose to use the mat to be able to perform specific flexibility tests to help the people that we work with.
这就是为什么我们 MAT 体系会选择采用一些更加具体的测试方法来测试跑者他的更加具体的测试他的柔韧性。
Because we see some specific tests even that have a high correlation with risk of injury when it comes to flexibility.
因为我们知道，就是在柔韧性测试当中，有一些专门的更加具体的柔韧性测试是与受试者的损伤风险有着更大的相关性的。
Yes, we see from the research that often individuals, if they have bigger than 2 centimeters difference between sides, are much more likely to go on and get a lower leg injury.
因为我们从有一些研究当中看到，在某些测试上，如果左右两侧差异大于2厘米的话，会增加下肢损伤的风险。
But that's not only in regards to ankle range of motion injury.
但是我们说到柔韧性左右两侧的差异，不只是体现在足和踝这个部位，
but also in other parts of the body, such as the hip.
其实呢，我们还要考虑下肢其他位置的柔韧性，比如说髋关节。
So in this study, they found that people who had decreased hip internal rotation were more likely to get knee pain.
比如说现在的这个看到的这个研究，它显示的就是髋关节内旋角度减少的人，他将更有可能有更大的概率出现膝关节疼痛。
So it is important to still assess flexibility.
那么测试评估柔韧性是否非常的重要呢？
And if you do find some limitations, you want to try and improve those.
是很重要的，而且如果你发现它在某些部位出现柔韧性受限的话，你一定要想办法帮它提高。
It's important to know the risk factors around injury so you can make better decisions with your clients.
我们需要去关注客户的患侧，然后找到可能的一个影响因素，这样才能够帮助他们更好的提高、更好的改善。
Now, the third deadly sin of running assessment is only focusing on the injured side.
但是这要说到我们的第3个跑步评估的大错，就是只关注患侧。
It's often very easy to only focus on the place that is sore or injured.
人们常犯的一个错误就是惯性思维下去只关注一个患侧，而这个错误是非常容易犯的。
But we need to remember to look at the whole of the individual.
但是我们也不能忘了要将这个个体当做一个整体去看待。
I think this is particularly important when we assess the strength that a person has.
我认为这一点思想，尤其是在对客户进行力量测试的时候尤为重要。
Often when we are assessing injured runners, we often focus on the strength of the injured side.
通常我们在测试受伤的跑者客户的时候，我们往往只测他的患侧的肌力。
And this makes sense because we need to understand how much strength that person has to tolerate the force of running.
这一点是好理解的，因为我们需要去了解这个患者他能够产生多大的力，也就意味着他能够去承受，是否能够去承受跑步时的一个反作用力。
We see in the research that strength training can help reduce injuries.
研究显示，力量训练可有助于减少损伤风险。
Sometimes almost by 1/3 to 1/2 the risk of injury by increasing strength.
有的时候，通过力量训练提高肌肉力量，可以将损伤风险减少1/3到1/2。
And this correlates with certain tests, such as a leg press test or a single leg sit to stand test.
而进行肌力测试的话，非常常用的，比如说有腿举测试以及单腿坐到站的测试。
There are certain numbers then we can use to identify if our clients are at risk.
那我们在通过这些测试评估客户是否存在较显著的损伤风险的时候，是有数据可以参考的。
For example, being able to perform 10 repetitions of a 1.5 body weight single leg press has been shown to reduce the risk of injury.
举个例子，如果他在做单侧腿举，然后负重是1.5倍体重这样的一个负重下，他能够完成10次，那就说明他是有一个较低的损伤风险。
And that makes sense, Andrew, when we consider the amount of force that goes through someone's leg each step they take when they run.
这一点很好理解，特别是当我们能够在考虑到说他每跑一步身体所承受的这样一个反作用力的大小的时候，我们就知道力量是多么的重要。
As we discussed earlier, you're putting 1.5 to 3 times your body weight through your leg each step when you run.
我们前面说过，每跑一步，身体都会承受自身体重1.5倍到3倍的反作用力。
And this also shows why it's important to be able to do at least 21 single leg sit to stand exercises.
这一点知识也就说明了为什么在做这个单腿做到站测试的时候，它如果是显示为健康或者是较低风险的话，它应该是能够完成21次。
If someone cannot control their body weight many times, it's going to be very difficult to do that when they're running.
因为如果这个人在测试当中都没有办法较好的控制他的自身体重，去重复的完成一项动作，那么他就更别说他在跑步的时候能否控制好了。
So they're two great tests to be able to test the whole lower leg strength on both sides.
测试整个下肢的肌肉力量呢，有这两个非常好的测试。
But strength is also important in the individual muscles locally as well.
我们除了关注整体以外呢，其实我们也不能忽略了局部肌肉的一个力量测试。
For instance, when you're looking at calf muscle strength and performing calf raises until fatigue, you should be able to perform at least 25 repetitions side to side.
比如说我们给他们做体重测试，然后体重测试的做法呢是一直做到力竭。那么在这样的一个测试当中，它测的主要就是小腿后侧肌群的力量，正常标准应当是左右两侧都可以完成25次。
And have no more than 8% difference in repetitions side to side.
而且左右两侧的差异不能够超过8%。
So here's one of our running athletes doing a single leg leg press assessment. So let's have a look.
现在我们看一下，视频中是我们的一个跑者客户正在做单侧腿举测试。
Well, unfortunately, it looks like that video is not going to play. But in this,
不好意思，网卡了。
So in this video, this runner was getting pain in his left lower shin.
不过呢，视频上面的模特他是左小腿左侧胫骨有疼痛。
He was actually able to press his body weight only 10 times on the left leg.
一开始呢，他做这个单侧腿举的时候，他的左腿只能够做10次。他左腿只能做10次，而且当时的负重是自身的体重的这样的一个负荷。Okay.
On the right side, he could not press 1 repetition.
而右腿的话是1次都做不了。
So he was both not strong enough to be able to run, but also had a big difference between sides.
一方面呢，他左右两腿的力量其实都不合格，都不能够让他安全的去跑步。另一方面，他左右两腿还存在非常显著的差异。
And I think the interesting finding for the viewers was that the painful side was actually the stronger side.
我觉得可能当大家会发现非常有意思的一点，就是测试下来力量强的反而是患侧，力量弱的反而是健侧。
And this is the reason why we need to not just focus on the injured side.
这也就是为什么我们在做力量测试的时候不能只关注患侧。
Because often a weakness elsewhere might be part of the problem.
Could you just repeat?
Often a weakness elsewhere might be part of the problem, or the stronger side might be the side that they use more.
OK，因为很多时候它的力量弱的地方反而不是真正出现损伤的地方，以及它出现损伤的地方反而可能是他自己非常注重强化力量的地方。
We also see, Stephen, some interesting numbers from the research that we can use with other pieces of equipment.
然后我们还从研究里面发现了其他一些很有意思的数据，可以用到别的测试当中。
For example, utilizing the axis system, we can start to measure strength and power forces.
比如说，我们使用这个现在图片上看到的 Axis 系统，我们可以用来进行力量和爆发力的测试。
And these results can be compared with specific results from the research to understand whether our running client has enough strength.
然后我们测试的结果可以拿来与现有研究提供的参考数据进行比较，分析我们的这些跑者客户他是否存在有损伤风险或者较大的损伤风险。
If you're interested in learning more about some of these pieces of research, you can go to the website below to download more interesting articles.
如果你对这方面的数据很感兴趣，想要了解更多，可以根据屏幕上给到的网址链接进入下载相应的很有意思的文章。
The fourth deadly sin of assessment is getting too excited by flat feet.
第4个跑步评估的大错是太执着于扁平足的问题。
So often for many professionals, they think that the flat feet is the key to all assessment.
在我们很多的治疗专业的人士来讲的话，他们通常遇到了评估当中遇到什么问题，都会觉得这个跟扁平足有关系，一定是扁平足导致的。
Unfortunately, it is probably not good to base your career around only looking at the feet.
但不幸的是，如果你只关注他的足以及只关注他的扁平足的问题的话，往往不能够在很多地方发挥好找到真正的原因所在。
That gentleman looks a bit like me with my current beard too.
然后图片上的这个先生和我现在还挺像的，因为我现在胡子跟他也挺像的。
It's very impressive.
所以呢，我就真是忘不了他了。
Often, many people who only look at the feet would look at the left picture and decide, I need to change this.
很多情况下，人们看到这样的2张照片，都会先关注到左边的图，然后觉得这个人肯定是存在着结构问题，一定要去帮他解决这个问题。
They might create an orthotic or a shoe insert to try and adjust the foot position and the mechanics.
然后解决的方案很可能是建议他带上一些矫形器或者是矫形鞋垫来帮助他调整骨骼的位置。
But what we know at MAT is that the foot is designed to be able to move in these ways.
但是我们 MAT 知道的一点就是说，人的身体结构它设计出来是可以设计出来，就是为了以此设计来满足各种运动要求。
So rather than make our diagnosis just based on how the foot looks, we like to use tools like the MAT to assess how the foot moves.
所以我们不是只从外表去判断它是否存在问题，而是要通过一些运动的测试来判断它的功能性是否合适。
For example, like how this very handsome patient is performing one of our favorite tests, the Star Excursion balance test.
举个例子，现在大家看到照片上的帅哥就在为我们示范我们最喜欢的一个测试，叫心形平衡偏移测试。
This is a great test that gives us lots of information about flexibility, balance, strength, and control.
那这个测试呢，它对于柔韧性、平衡、肢体控制等都有一个很好的反馈。
And once again can be used to identify whether your running client is at risk of injury.
它也可以用来反映你的跑者客户是否存在着损伤风险。
So when we look to the research regarding what happens at the foot, we see that just because someone has flat feet doesn't tend to increase their risk of injury.
当我们回顾一些关于足的结构与损伤风险之间关系的研究的时候，我们会发现，其实它的足的一个结构特点与它的损伤之间未必就存在必然的联系。
So this is why we need to use movement-based assessment to understand our clients properly.
这就是为什么我们是需要通过运动评估或者动作评估来更好的了解我们客户的结构特征。
For example, Stephen, we can use slow motion video analysis to look at our clients.
举个例子，我们可以通过视频，然后慢速播放，以此来分析我们的客户。
So rather than just looking at the foot in a static position, we can start to look at how the foot is positioned in running.
所以我们除了是看客户在静止状态下的一个足的结构以外呢，我们还可以在跑动中观察他的足的状态和变化。
This is likely to give us more information as to whether or not there is too much movement or too high forces for this runner.
这样可以给我们更多的信息来判断这个人在跑步的时候是否下肢会承受过高的一个冲击力。
And we can do this using simple applications found on smart devices in the current world.
而且呢，像是图片上所展示的这种软件的话呢，在现代的很多智能手机上都可以找到很多了。
Not long ago, this type of technology would have been very expensive.
在不久以前，像这种技术还很贵呢。
And we teach in our online courses how to utilize some of this technology.
而我们的课程上面，我们会教给学员怎么样使用这些技术。
So the fifth deadly sin, we're working through them now, Andrew, is thinking that patellofemoral pain syndrome is only about the VMO muscle.
第5个跑步评估会犯的大错就是认为髌骨疼痛综合征只与骨内侧肌的斜向纤维有关。
When I came out of university, knee pain was very easy to fix.
我刚从大学毕业的时候，那时候认为膝疼痛怎么解决的方法会非常简单。
In runners, what we would do is get some tape and pull the kneecap across.
比如说，如果是跑者他有膝痛的话呢，通常就只是拿一个贴布把他的膝关节、把他髌骨给固定回到正确的位置上。
But unfortunately, not in every patient that didn't help.
但不幸的是，这一招不是对所有的人都管用。
And that's because there's lots of different factors involved with injuries.
这是因为看似同样的损伤，但其实其中的作用因素可能是有很多的，而且可能是不同的。
Especially in knee injuries in runners.
特别是以跑者的膝损伤为例。
We need to consider how the knee actually works.
我们要去考虑他的膝关节到底是怎样作用的。
Often we think of the kneecap as something that just sits on top of the rest of the leg.
我们通常只是将膝关节看作是将髌骨看作是一个被动的，只是置于我们腿上的一块骨。
But it is part of a complex relationship with the whole lower limb.
但其实呢，髌骨它是在整个下肢的复杂体系当中的一部分。
Healthy lower limb function involves a synchronization between the foot, the knee, and the hip.
下肢功能正常，这就意味着在足和踝、还有膝、还有髋这几大关节之间要有协调的配合、协调的运作。
We now know that patellar femoral pain syndrome is often when there isn't a healthy relationship between all of these areas.
我们现在知道了，髌骨疼痛综合征的发生，通常就是因为我们前面所描述的这几大关节之间没有一个健康的配合，没有一个协调的配合。
For example, in this diagram, if there is too much movement occurring at the foot and the ankle,
举个例子，比如说这张图上显示的，如果是足和踝部分的活动过于剧烈，
and the movement up higher through the rest of the leg is not able to accommodate this,
而他们上方的这些其他关节的运动却不能够配合协调。
we can imagine how the patellar bone is not synchronized with the rest of the leg and more force maybe pulls to the outside of the leg.
OK， 那么我们就可以想见我们的髌骨是没有办法很协调的参与到这整个下肢的运动当中，以及在这种情况下，在图上所示的情况下，膝外侧会承受过大的力。
The reverse can also happen.
反过来也一样。
For example, if an individual has too much range of motion through the hip,
举个例子，比如这张图上告诉我们，如果这个人的髋关节活动幅度过大，
but is not able to control it adequately with strength and stability,
而下肢的力量和稳定性又不足以来控制这样的活动幅度，
then potentially this could be another factor causing or not enough synchronization of the patellar bone.
那么这也会导致髌骨无法协同的参与到整个下肢的运动当中。
We need to also think about how this joint might work.
我们同时呢，当然也要来考虑膝关节它是怎样运作。
Not always is it about the patella just moving on the femur.
我们在考虑膝关节活动的时候，我们要知道，并不总是髌骨在那个股骨以及胫骨之上滑动。
We need to also think about how the femur might move underneath the patella.
我们还要去考虑的是另一种情况，就是股骨如何相对于髌骨做滑动。
So this is why having a comprehensive assessment approach, Stephen, is so important.
这就进一步说明了为什么我们要给客户带来一个综合性的评估，这是非常重要的。
And very important, especially in the hip joint, because all of the biggest muscles in the body are positioned around it.
然后评估髋关节也是非常重要的，因为髋关节周围附着了很多的大块肌肉。
And if you don't have adequate range of motion through the hip, then those muscles that create lots of force will be unable to work as effectively.
如果我们的髋关节没有恰当的活动度，那么髋关节周围的这些肌肉也无法有一个恰当的发力，无法协同的参与到运动当中。
Number 6, Andrew, only assessing the client when they're fresh.
第6个大错就是只在客户不疲劳的时候做评估。
So fatigue is usually when someone has a reduction in their strength due to the demands on their nervous system.
什么是疲劳呢？这里的定义是说，因为由于中枢神经系统来的冲动减少而使得肌肉的发力减少。
And fatigue can lead to lots of things in the lower limb in runners.
而疲劳对于跑者来讲，会让他们的下肢损伤概率增大。
Can lead to increased motion at the foot, increased motion at the knee and the hip.
正如这里所示的，疲劳会导致后足的外翻速度加快，然后会使得它的膝关节的活动和髋关节的活动变得更大。
This study highlights the effect of fatigue on individuals very well.
这个研究呢，则是更凸显了就是疲劳对于个体他在做测试时的表现。
In this study, they performed a hop test in a fresh state and a fatigue state.
这个测试显示了更一步的显示了疲劳会如何影响到个体的测试表现。然后这个测试呢，是在疲劳和非疲劳状态下分别进行这个单腿跳。
In the fresh state, they had less than 10% difference side to side.
在非疲劳的状态下呢，他们在做单腿跳的时候，左右两侧的差异是小于10%的。
But when they were in a fatigue state after performing a fatigue protocol, they had a 68% difference between legs.
OK， 那么但是在这些受试者他们在执行了疲劳方案之后，再次进行单腿跳测试，他们的左右腿差异是有68%的，有对称性异常。
So this is often something that is missed, but something that is critical as part of your assessment process.
所以呢，像疲劳这个因素，它是否疲劳，通常可能在评估的时候会被忽略掉。
So what are some different fatigue protocols that the viewers can use with their patients or clients, Stephen?
那么就是说我们在给客户做评估的时候，我们可以使用哪一些疲劳方案呢？
Look, for our runners, the most specific thing is to get them to go for a run and then assess them.
那如果是评估跑者客户的话，那最简单的一个做法就是让他们先去跑，然后再回来做测试。
And try and reproduce the distance they run or the distance where their pain or injury might come on.
并且这个跑步这个疲劳方案呢，是尽量去模仿他们平常的一个训练，或者说是容易出现疼痛的那种情况下的那个跑步的距离。
But if that's not possible when you're working with your athletes, some things you can do are things like step ups, repeated leg press, greater than 25 repetitions, or counter movement jumps.
那如果条件不允许，不能够让他们去跑的话呢，还可以采用别的方案，比如说上台阶或者重复腿举。我们记得，要正常的话，应该是能够大于单侧要能够分别做超过25次，然后又或者进行反向跳，也叫做预蹲纵跳。
Usually the aim is to get sufficient fatigue that they can feel some discomfort in their muscles and get their heart rate around 85% of their maximum.
那么我们进行疲劳方案的目标呢，是要他们能够达到最大心率的85%。Guys, I'm sorry, I just realized that I made one mistake in talking about in prescribing the repeated leg press. Can I correct myself?
Go, please.
Yeah, because you said should be more than 25 reps, and I said I said it's to do. I said it's the criteria for clear somebody as with no.
Oh, okay. Yes, that's
Okay, thank you. 那么我要更正一下我前面翻译的一个错误，也就是疲劳方案当中的重复腿举。那么他们说的呢，其实是说在让客户做这个重复腿举的时候，它应当是大于25次，这是作为疲劳方案的一个练习变量。Okay, done. Please go on.
Thank you. The last deadly sin, Andrew, not continuing to work with the injured runner.
好，那最后一个大错就是不继续与康复后无损伤症状的跑者合作。
Yes, Stephen, I think we often think that once the runner no longer has pain and no longer is injured, that all of our work is done.
是的，因为我们常常以为，就只要我的这个跑者客户他没有损伤了然后他没有疼痛了，然后就可以结束合作了，他就可以继续回去训练了。
But as we described at the start of our presentation, runners are some of the highest risk individuals of getting injured.
但是其实我们在这堂课一开始的时候就说过，跑者他们是非常容易受损伤的一类人群。
And unfortunately, runners who have been injured within the last 12 months have an even higher rate of re-injury.
而且我前面也说过，如果他在此前12个月内有受伤的话，那么他接下来受伤的概率会更高。
So this is where making sure we have a detailed measurement and assessment process is so important.
所以这就说明了为什么我们需要有一套详实的评估手段和评估方案。
To make sure that we can identify if that non-symptomatic runner is still at risk of injury.
这样的话，我们才能帮助我们去发现这个当前症状已经 没有了的这个客户，他是否仍然存在一定的损伤风险。
And making sure that we continue to increase their strength and their conditioning.
以及能够让我们可以帮助这些客户持续的提高他们的力量和体能。
To continue to optimize their performance, but also make them stronger and more robust.
持续的提高他们的运动表现，然后让他们能够有更强健的体魄，有更好的损伤预防能力。
If you can start to use an objective assessment process like what we perform here at MAT,
如果你能够像我们在 MAT 一样采用客观的手段去做评估，
you'll be able to use numbers to continue to show your patients and your clients the importance of still training or being cared for by you.
那你手头就可以拥有详实的数据，向你的客户或者向你的患者证明持续与你合作的重要性。
Even when they don't have pain or injury.
即使这个时候他们已经没有疼痛，看起来已经没有疼痛或者没有损伤了。
So, Andrew, there are the 7 deadly sins of running assessment.
好，那么安德罗，刚才我们所说的就是跑步评估的7个大错。
Hopefully now that you know the 7 deadly sins of running assessment, you won't make these mistakes with your running athletes.
希望在学了这个课程以后呢，你就不会再犯这些错误啦。
The most important thing to do is to perform a very thorough assessment of the running athletes that you work with.
对于评估跑者客户来讲，最重要的是要给他们进行详细的、全面的、综合的评估。
And if we have data to be able to track their progress over time, we can make sure they hit some great personal bests.
而如果我们手头有尽量客观的这些数据来记录并且追踪他们一路的进步的话，那么我们可以帮助他们持续的获得更多的提高。
All right, Andrew, I think we'll finish this session here. Thank you very much to the team at IDFit.
那么我们今天的课就到这里了，非常感谢 Idea 团队。
Thank you to for translating our Australian, Amelia.
You're welcome. 谢谢我们的翻译小姐姐来把我们这些带着口腔的带着澳式口音的英语也都能顺顺的翻译出来。
And thank you very much to Lee for providing us with this opportunity.
然后也感谢能有这样的一个机会，让我们能通过这样的方式与大家分享。
We hope the rest of the seminar is fantastic.
我们希望其他的课程也都一样的精彩。
If you do want to find out more about us, there is a link there for our course next year when we come to Shanghai.
如果大家对于我们的课也非常感兴趣，想要了解更多的话，可以输入这个屏幕上的链接进去了解。我们明年会来上海开课。
Thank you. 谢谢。
谢谢。